I'm Jill Gilbert. I'm the producer of this event. And if you were here yesterday for their sessions, you'll agree with me that this was just a huge amount of exciting and inspiring ideas and insights shared by our terrific panelists. And they came from a wide variety of backgrounds, many of whom you may have found surprising at a health technology conference. We had automakers, triathletes, kitchen appliance manufacturers, and more. We learned about how digital health can make a needed difference in the diabetic epidemic, how our kitchens and our cars can help keep us healthy, and heard some visionary forecasting on everything from personalized medicine to genetics, wireless, health, and more. It was truly amazing. Well, today we have an equally intriguing and varied lineup for you. Over the next 8 sessions, we'll discuss big picture areas like standardization for digital health technologies, who's paying the bill for e-health advances, new ways to manage the aging process, and the changing paradigm between the doctor-patient relationship. You've definitely come to the right place if you want to learn what's happening now in digital health and what's happening in the future. Now, at this point, I want to give special thanks to our platinum sponsors who help make all of this possible. Ant Plus, Continua Health Alliance, Ideal Life, Life Technologies, Quality of Life Foundry, Scientific American, and United Health Group, all of which have fabulous exhibits down on the Digital Health Summit floor downstairs. And before I introduce our opening keynote, I'd like to cover just a teeny bit of housekeeping. Because we have so much information to share with you today, the sessions are quite tight together. So when each panel is completed, I ask you to take your conversations outside and give this next panel that's going to be coming up the attention they deserve. Second, if you have a smartphone, please set it to silent during our sessions. But feel free to tweet away. We are using #DigitalHealth as our hashtag, and you can follow us at dhsummit.com. Third, and this applies to all of our sessions today, if there is time for audience questions and the moderator opens it up, you can stand up to the microphone that's back there and line up there, but I ask you to keep your questions to just that, and that is questions. Please do not give any pitches. Those can be done outside. Now, before we move on, I also want to mention our 2012 gold sponsors, and we really appreciate their participation this year as well. AARP, Alcatel-Lucent, Audex Health, Body Media, Qualcomm Life, and Tanita. Now, what's in store for our opening keynote today? Wireless. It's what a lot of people think of when they think of digital medicine, and it's an area that holds so much potential for patients, doctors, medical centers, and for the technology companies that are enabling kinds of connectivity. I'm quite honored to welcome our keynote speaker, Don Jones, Vice President of Wireless Health, Global Strategy, and Market Development for Qualcomm. Don is responsible for Qualcomm's development of wireless technologies and platforms in the health, fitness, and life science markets, and is recognized as a leader in the field. In 2005, he founded and is chairman of the Wireless Life Science Alliance, which works with both the wireless and health industries to enable new business models, new businesses, and clinical process improvements in all sectors, including consumer health, fitness, healthcare services, healthcare IT, pharmaceutical, and medical devices. Don will be introducing a very special guest from my alma mater that we're very excited to have join us as well. So with that, I give you our keynote, Don Jones.
Thank you, and good morning, everybody. Glad to be here. We've got some exciting things to show you a little later, but I'm first going to take a few moments and tell you a little bit about what's happening in the wireless industry and what Qualcomm is doing in the wireless industry to bring wireless technologies to life in the health and healthcare fields. Today, see if my slides are... I don't know if I've got control here, guys. Just a... Great. So this morning I'll give you a little introduction and then we'll go on to our special guest. Qualcomm is the world's largest supplier of wireless technologies to the mobile field, and mobile has rapidly become the dominant platform. Most of the world will access the internet through their wireless devices. the network itself is actually to become the most pervasive public utility in the world. More pervasive than running water and electricity. Because more people have access to that cellular network than they do to those other two utilities. There's 6 million subscribers, a billion subscribers on the wireless networks around the world today. 2 billion more than use toothbrushes, which is why we're pretty confident video chat's going to be really important in the future. Consumers are beginning to expect the amazing out of wireless. You all know your own personal experiences, but as the devices come and offer more and more features, we're obviously integrating them into our lives in many, many more ways, whether it's through social networking, and through internet experiences, and through obviously the app world. And of course, all of this is going to apply to the healthcare world of fitness, consumer health, wellness, and traditional healthcare delivery. What's interesting about this experience is that we're really creating a world of the Internet of everything. Everything is going to be connected in your life. We expect there to be a growth from about 6 billion connected devices to about 50 billion connected devices over the next decade. It's a roughly a tenfold increase. And you may be wondering why a company like Qualcomm making cell phone chips for mobile devices would be featuring a washing machine. Well, envision a world in the future where your washing machine tests the water, recommends the soap, and allows you to order the soap from the machine itself. This is what we're going to see in terms of appliances and everything else you touch in your house that will be connected in one form or another to provide services to you in addition to kind of the traditional roles that appliances have played in the Internet of Everything. And of course, as we move into healthcare products, we're really talking about the products enabling the consumers to manage their own health, to become their own CEOs of their own health, to get feedback in that loop, to have more productive interactions with their healthcare providers because they know more information about what's going on in their life. So as the devices become connected, they become smarter, and the consumer becomes smarter in the process. It's a global issue in the traditional healthcare world. We've got a very expensive system. We all know because it's headlines every day in the US about the cost of the US healthcare system, but the reality is the costs of healthcare around the world are a problem for almost every government and every society in the world. And whether it's 6% of GDP being spent, or as the US is approaching, and we can see in sight 20% of GDP being spent on healthcare, there's a problem. But the problem goes even beyond what's happening on the cost side. It goes to how many people are available to actually provide healthcare services. We're going to end up with a fairly significant shortage of healthcare providers, physicians, nurses, et cetera. We're going to have to transfer, at least for the mundane healthcare activities into self-management. And wireless and a consumer electronics approach to reducing the cost of getting information and actionable data into the hands of consumers is part of that solution to solve these problems. The trends around the world here in the healthcare are to move away from that sick care market and into a healthy market. And of course, you're all seeing that in the world of wellness and fitness very quickly. Here at the show, you're seeing many, many examples of wellness-related activities and products and/or services that can help people maintain their lives at home, age in place, and take care of routine healthcare needs. In addition to that, we're going to see the acute patients being taken care of at home, being sent home with devices where previously they might have had to stay in a hospital or stay in a step-down unit or skilled nursing facility for extended periods of time in order to get monitoring services, et cetera. And what's happening here is the technology is going to allow us to send these patients home into the future. I'm going to give you a quick example. This is a traditional Holter monitor, an ECG, electrocardiogram. It's got a lot of moving parts there. Doesn't look very attractive. These are all Holter monitors or ECGs of the future that are actually here today. These are combinations of what we call smart Band-Aids, cell phones, and ways of communicating with healthcare professionals onto their cell phones to basically monitor cardiac functions so that the patient can have the peace of mind that they're being monitored, the physician can have the peace of mind that the information they need is being present, the appropriate alarms or alerts can happen, and the patients can go about their lives away from traditional bricks and mortar healthcare facilities. Very different environment here than that traditional healthcare, the traditional Holter monitor I just showed you. And the example here with Airstrip in the example allows physicians, it's a company that allows physicians to remain directly connected to devices that are on or in patients' homes, helping to monitor those patients. We're seeing the same thing happen in diabetes, another huge global market. And we're seeing the technology evolve to the point where patients can be enabled with self-management tools. They can have tools that tell them much more information about what to do next. We just demonstrated on Tuesday morning the world's first continuous glucose monitor reporting directly to an Android phone. So continuously a diabetic can actually see on their phone exactly where their glucose levels are through Dexcom. And Cellnovo up there has an insulin pump that actually not only is an insulin pump, but it's a store for all of the supplies they have on the controller. It's actually an Android phone that gives them the ability to order all their supplies, order food products, and play games. And not only play games with other diabetics, but in a social networking environment, but play games with other people that aren't diabetic at the same time that encourage them to do the kinds of activities they need to do to manage their condition. Qualcomm has spent a great deal of time over the last years building an ecosystem of companies that are interested in wireless health. And in those discussions, we found some needs in the marketplace, which caused us in December to launch Qualcomm Life, a brand new company, Qualcomm's healthcare division. And Qualcomm Life launched 3 initiatives. We launched a cloud-based platform, a small internet hub that looks like a nightlight that plugs in the wall, and a $100 million investment fund, all as part of our Qualcomm Life initiative. And what Qualcomm Life is doing is taking devices, medical devices and health devices, and making it very, very simple and easy to get them as onto the network, to be nodes on the network, to get the data flowing from those devices up to the network into a cloud platform, so that then those data points can be exposed to the software industry. Developers can make interesting user interfaces and apps for you to use to manage your own health. And so the data analytics community can get access to information and provide useful analytics and useful actionable data back to both the healthcare professionals and the physicians. So we have this platform, we have this very nice little hub, and if you want to come to our booth in South Hall or here in the Digital Health Summit, we can show you how very, very easy it is to put a device onto the net and then make it part of a larger ecosystem where data can be shared across many devices. This is an example of the hub itself. You see it's actually just a very small little nightlight-looking device. Very simple set of instructions. The instruction set is open the box and plug it in the wall. If it recognizes any device that's on the cloud platform, it automatically grabs the information and sends it up. There's no pairing, there's no other activity the consumer has to do to kind of get things started. And the point is you now can combine data from devices from different manufacturers into applications, so you don't have to go to different websites and different applications to see everything all at once. Has lots of different radios in it, uses cellular for the backhaul, and it uses lots of local area radios for the local area in the room, say in the living room or in the bathroom of your home. Just one of many ways, very simply, to connect devices to the internet. The important part about this kind of platform is that it's allowing data to be collected and aggregated from multiple devices and then shared out to not only the users, but to various analytic software applications that can very much help you understand what's the important thing to do next. So whether that information needs to be available to your healthcare provider, to you as the consumer, or to your payer, that cloud sits in the middle to aggregate across multiple suppliers of data. We're also pushing forward on innovation by, on Tuesday morning, we announced the creation of the Qualcomm Tricorder X Prize in conjunction with the X Prize Foundation. This is a $10 million prize purse for the first entity in a global competition to invent the Star Trek tricorder, the little handheld device. We're allowing a little bit more weight than what they perhaps showed in the TV, but we're allowing up to 5 pounds of hardware to be put together to make diagnoses for the consumer, that a consumer can use on their own without any outside help to make diagnoses in 15 categories. Anybody that's interested can go onto the XPRIZE website and see what the criteria is. It'll be a 42-month competition globally. There's already many teams located around the world that are going after it. There's even a company that was formed in venture capital finance to actually go after this prize already in place. So I think you're going to see a lot of news about this Tricorder Foundation, and what we're really talking about is taking an amazing amount of sensors that are out in the world, getting them combined into a common device, putting the software wrapper that allows the analytics to analyze data from many, many points to rationally make a diagnostic and actionable set of recommendations to the consumer, again, enabling that self-management. In the US, you can imagine using that at home. In other countries, developing countries around the world where you don't have the healthcare professionals, you can imagine how valuable this kind of tool might be. So this is really pushing the envelope in a direction the medical devices have yet to go. Our whole goal here is to get as much information off of people to help empower them to manage their own care, manage their own health, get the feedback necessary to do so, and do so in a much more informed way with their own healthcare professionals. We refer to this as getting everybody on the net. I hope you all to have a chance to come to our booth and see some of the activities we have with Qualcomm Life and with our platform. So with that, I'm going to conclude the part of my talk about talking about what we're doing in this space and with the wireless industry, and ask Leslie Saxon to come up and join me on stage. Leslie's a good friend. She's the director and founder of the Center for Body Computing at University of Southern California. She's the chief of cardiology at the Keck School of Medicine at USC. One of the few women in the world that's actually a chief of cardiology in a major academic center. Leslie, thank you so much for joining me.
Thank you for inviting me. It's a pleasure to be here.
Leslie, a few years back, you were doing clinical practice. You were seeing patients every day, and you somehow decided to launch a research institute focused on body computing. What did you have in mind, and what have you done?
Well, I had rumblings, and I was thinking of doing that, and I met this guy called Don Jones, who really kind of helped me form some of my ideas. But so I'm an invasive cardiologist that treats arrhythmias, sudden cardiac death, and other arrhythmias that occur in the presence of heart disease and without obvious heart disease. And I put in those devices and help develop a device that prevents sudden death and treats a very common chronic disease in this country that's very expensive called heart failure. And those devices became networked in 2006, meaning you could suddenly not just have to see a patient to find out what their heart rate was doing. These patients with advanced heart disease, you could follow it on the internet. And I realized that I'd become this kind of doctor that spent 90% of her time doing 600 interventional procedures a year, would mash all my patients into a Thursday afternoon clinic. I couldn't really be the type of doctor I wanted, or make any of the kind of sentinel observations that I needed to make across populations to move these devices and field forward and move the needle on heart disease. So I thought, I need to be able to understand how to harness this ruthless efficiency of this network data to better serve my patients, to reach more people, and to be personally, kind of satisfied. So it was very organic. And then as we started to explore what it means to take data from your body computer, we realized that the implications were more profound than anything the internet has done. That you could actually, through looking at massive amounts of data and connecting patients to their own data, create enormous movement in healthcare outcomes and in healthcare diagnosis. So the profundity of that sort of occurred to me, and then I started talking to people that you've and others have introduced me to, and realized that this is something that's going to require many disciplines outside traditional medical science to enable. And that created this amazing opportunity to be creative and really have science meet medicine in a way that would actually improve mankind's status in the world. So all that really drives me from a very practical, what am I doing with my time every day? I've been doing this for 20 years. I have a lot of experience, but all my knowledge is kind of caught in East LA where I work, and what if I could reach more people and many people like me across areas of medicine.
So I know you reached out to the School of Medicine. Obviously, you're in it. You reached out to the School of Engineering, because that was important. You reached out to the School of Business, which happens to have a center for telecommunications, which was important. But you reached out to a fourth entity, which was the surprising entity. And tell me a little bit about how you work with the School of Cinematic Arts.
Well, the USC School of Cinematic Arts is probably the best film school in the world that also is very technology driven. They have an Institute for Creative Technologies. They work with the Defense Department in virtual and augmented reality, and they can really tell a story. And what's more emotional than your own healthcare narrative? My brother's actually a film producer and a graduate of that program, and I had many friends there, and I knew the dean. So how do you engage patients and educate them, and even engage and educate physicians on healthcare costs, outcomes, and really the experience of healthcare? You create this emotional narrative, and you meet patients where they live. You don't isolate healthcare from their life and make it kind of a shameful, difficult, arduous, paternalistic experience. You try to make it an integrated, engaging, and you play off the emotional aspect of it and try to respect and create an environment where the patient actually is motivated and franchised, accepted, and hopeful. So the School of Cinematic Arts has been instrumental in helping us create those narratives and understand what we need to do, what products we need to create, whether it's over mobile or really within a one-to-one clinic environment to enhance that healthcare experience.
Well, let's talk about some of the things you're working on. We both had a chance to meet a former chief medical officer of GE Healthcare, and who created a very inexpensive but very creative way of viewing cardiology and ECGs. And so, AliveCore. Why don't you tell a little bit about what you've observed working with AliveCore?
Yeah, well, one night I was searching YouTube and I found our friend Dr. Dave Albert, who's a Duke-trained cardiologist who's in Oklahoma. And you mentioned prior career at GE, but he developed a very simple iPhone case that you can put on your iPhone, touch these electrodes, and get a real-time lead one regular EKG. And I was fascinated by that and sort of bugged the heck out of him. And he agreed to come to our conference, and he said, how do you think I should use this? Is this something for you, just a doctor? Is this something that we should have some kind of other commercial consumer play? And we said, well, let's, as you and I have discussed a lot in our conversations, what's the use case for some of this disruptive body computer diagnostic technology? So at our annual body computing conference, we gave out these cases to 50 people who were there. Only 15% were 50 of the participants who had iPhones. Only 15% were doctors. We had film people, media people, business people, students, and just said, take this home, transmit whenever you want. Dr. Saxon's doing this under a clinical trial. I'll look at these every night, and we'll see what happens. So that little study that I'm writing up now has really been a fascinating journey.
You found a lot of unexpected things out of a population that was kind of randomly picked here.
Yeah, first of all, it's very sticky. This is the one thing that's with you all the time, right? You never leave your house without this. You forget your car keys before you forget so, and you go back home for this, right? So everybody who was in the study used it, 4 to 6 times a week through the 8 weeks of the study. The other thing that was humbling for me as a cardiologist who just deals with arrhythmias is we detected some pretty significant abnormalities in people who thought they were healthy. So the reason that's profound for me is that there are about 250,000 sudden cardiac deaths a year in this country, real tragedy. Sudden cardiac death is defined as death occurring within an hour of symptoms. So, everyone knows someone who died suddenly or has a story. It happens in athletes. It happens unexpectedly. And at full 30% of the time, we don't know the reason why somebody died suddenly. So, for instance, we detected a pretty malignant arrhythmia in a guy who was previously healthy. If he hadn't had the case and recorded his arrhythmia and came to see me as a cardiologist because I subsequently saw him as a patient, he happened to live in Los Angeles, he's now my patient, I would say, hey, you're 35, you just had some palpitations, almost passed out, but it happens, you had coffee, you worked out. He actually had a pre-sudden death arrhythmia, and now he's on a completely different pathway. He would have just been another number, sudden cardiac death, don't know why he died. Maybe it's a genetic abnormality we've not yet identified. So that for me is pretty important.
Well, that's pretty serious stuff, but you're also working with BMW and cars?
Right. So how do you get this type of information out, and how do you get people sort of addicted to wanting to know signals from their body computer and educated and informed and advocating for themselves and others? Well, it doesn't always have to be a medical play. What if you're driving your BMW and you've spent a lot of money on this car and you're into the driving experience, you're a techie, even if you're driving from your law practice in downtown LA to West LA, wouldn't it be fun to understand what your heart rate is as you're taking corners and you've got this intelligent sensor-driven car, to compare your own heart rate to a race car driver, and then the health can kind of just sit in the background, or maybe you key into your health channel get your heart rate and blood pressure. So a partner company of ours, and a really exciting company, Zephyr Technologies, that has very interesting wearable sensors, was asked by a steering wheel manufacturer in Europe to develop a prototype on the BMW steering wheel to record, to put their sensor in the steering wheel. So you just, in their smart fabric, which is the way they engineered it, you just touch this fabric, it records your heart rate, respiratory rate, some other things, and incorporates it on your screen, on your health channel or your car fitness channel or whatever it's ultimately going to look like. And then that just becomes part of your enhanced driving experience.
So maybe let's talk a little bit about the serious side of healthcare, kind of your electrophysiologic side of healthcare, where you've been working with some of the big manufacturers that make cardiac implants, folks like Boston Scientific and others. You've been approached to solve some major issues there, I know, from these companies. Why don't you talk a little bit about what you learned in the studies you've done having to do with monitoring patients, and what problems you think wireless technologies can be used to solve some of these problems?
Sure. Well, the fascinating thing, there are about 3 or 4 million people just in this country with implanted devices, defibrillators, or pacemakers. And once they become wireless and you can communicate with them, you can suddenly make amazing observations across huge numbers of patients. The largest clinical trial for defibrillators had 4,000 patients in it. We now, within just one manufacturer of patients with implantable defibrillators, have 200,000 patients transmitting data from their devices every day. That's profound. So Boston Scientific partnered with myself. I chair this altitude study group and a number of other thought leaders in my area across the country, from Mayo Clinic and Penn and others and Duke. And we said, look, let's query this database and do really wireless research across these large populations. And what we found was that in this really high-risk population of heart failure patients that have these devices that have high mortality, if they're followed on the web, just that partnership, just knowing they're transmitting data every day, being able to push data to their physicians, if their devices are followed that way versus slugging in to see me every 3 months and hoping to compress some kind of information in that pressurized 5-minute visit when they're naked, and I'm running around trying to rifle through their medical records, if that's a more relaxed, continuous relationship, those patients live longer. They actually live longer. And probably it's because they're engaged in their healthcare, number one. They're pushing data to us, so there's actionable stuff we're picking up early and continuously. And it's better. We know them better, they know us better, and guess what? It's efficient for me. It really reduces the cost of following these patients to our clinic by 1 full FTE just on our 600 patients. We could then use that high-end, high-cost nurse professional to do something else, like really interact with our patients in a more meaningful way. So those observations continue to happen. It's growing. We can't believe the stuff we're finding out. These are people who've been doing this for 20 years. We're really learning new ways to design devices to make them more cost-effective, to make them serve patients better and manage their disease. It's cool stuff.
Well, speaking of naked, you didn't confine your research to patients. You went out and went after the USC football team.
We did. So these are the guys. And this is the USC, this is the core starters of the USC football team, our little football team, our Division I team that's taken a little NCAA beating. But this is part of an NFL grant where we were very interested to learn, what places some of these young, talented athletes at risk for major cardiac issues. And if you were to use traditional cardiac screening for elite athletes or NFL players, you'd end up benching 30% of the NFL. For reasons that you didn't need to, and that's a lot of talent sitting on the bench and a lot of heartache, right? So we got this NFL grant to monitor players during play. So this is a scrimmage game in the Coliseum of USC players, and you see all their mean heart rates there, every player on the field and the range of their heart rates during gameplay. We're the first people to do this. But that's interesting, and that's during a tackle. You see that little noise there? That's the one player who got tackled, and that's his heart rate during an actual tackle, the time of potentially ultimate stress for an elite athlete during a game. So we think this will create a safer playing field, but to really understand this and get this out across all professional sports and monetize it, you really have to use this data for something else. So we're very compelled to say to fans, how would you like to have some predictive analytics if you knew Tom Brady's heart rate? And be able to say if he'd make that third down conversion. If we start to collect this data, we can make those kind of predictions and provide those analytics for fans. We can also provide important analytics for trainers. Zephyr and other companies are working on that to train and prevent injury, a very expensive and horrible thing for a professional athlete. And then potentially the health just sits in the background. You don't have to monetize it. but you can use it for the greater good, but you've already made so much and created such an environment around just the statistics for fans or trainers or injury that you've created this ecosystem.
So these become new apps.
Yeah, so one of the apps that we're interested in doing is our 700 athletes at USC, our 700 elite athletes come into this environment, and they've got a lot to handle. They've got NCAA rules, they've got to eat well, which they don't, and hydrate, they've got to go to class. And so how do they manage the complexity of all this? And so we're developing an application that's health-directed for them, where they can kind of life log and track their diet and their fitness, but also kind of tells them where to be and meet some of their other needs. Again, bringing traditional medical and wellness stuff to their needs in popular culture, and hopefully entertaining them with this and putting a sensor on their iPhone, but also giving them some real practical examples. And the other thing that the athletic department challenged us with, which was really interesting, was they want to create new, real student athletes. These are students first, and they want to, raise the academic level of our athletes. So they want us to also let the students know if Maya Angelou's on campus, so they can go here and read part of her book, so they can actually get some college experience out of this, because they are pretty busy young people. So we're attempting that. Well, so that's exciting. Those are in NFL players. So this is a relationship between Zephyr Technologies and Under Armour that provides apparel to the NFL for the combine and such. And what they're doing is they're actually using the sensor data to enable scouts to make better decisions during the combine. They were there last year, they'll be there this year, in order to better assess their suitability for play. So it's not just the 40-yard dash, maybe it's your acceleration in the first 10 yards of the 40-yard dash to better select players, protect players, train players, and they're getting into other major professional sports as well. And this is a very powerful area because, again, there are many pathways to monetization of this data, but it's also has a very important health play for the athlete and for others. The thing I also love about it is, if you want to really extend wellness and health awareness throughout the country, what better way than to get this stuff on an iconic athlete? Now you're not just getting poor kids to buy shoes that Michael Jordan wears that they can't afford, but you're getting them to want to wear sensors on that playing field in East Texas or whatever it is to be like Mike, and then they're actually doing something good for themselves, and you're, again, moving this needle on health awareness and safety.
So when I first met you, we talked a lot about heart rate, and we didn't have the typical clinical conversation about heart rate. We talked about how heart rate could be instrumental in social media, and could be instrumental in gaming, and could be instrumental in all kinds of areas outside of just traditional way a clinician would normally work with it. And that led to you thinking about jellyfish.
So I Heart Jellyfish is a game where the kid wears, or the adult, wears a sensor. We developed this with a game company out of Vancouver called Iogo. That you actually made that introduction for us. A group of guys, really do-gooder guys who have a number of very successful mobile apps and computer-based games, but wanted to get into health. So we said, okay, how do we create a game around heart rate for kids who are very precocious and interested? And we created I Heart Jellyfish, where you wear any sensor. The sensor doesn't matter. Your heart rate goes to the iPhone, goes into the game, and your luminescence grows as a fish, depending on what your heart rate is. And as you modulate it, you win or score points in the game. So we're now studying how that impacts kids' awareness of heart rates. But I view this type of thing as sort of, anybody who has children in their house knows is that they really control a lot of behavior in the household. So when I was a kid, we got my mother to quit smoking, because we started getting health awareness in the 70s that probably wasn't a good idea, and she became aware of that because of all the pressure. I think a lot of what happens around health in the home and awareness will happen with children who themselves get educated, know how to use this technology, aren't afraid of it, and then drive healthier behaviors. And so that's part of the goal there.
So as you've gotten familiar with kind of the game creation side, working with the school, you've actually turned off to the dark side here a little bit and started working with little vampires.
Yeah, so one of the challenges that we put out in the Center for Body Computing was to get people to just join competitions to create great game apps for sensors. And this is a really clever and elegant sensor that Egamatrix produces that was, I believe, the first medical sensor to get FDA approval that clicks into an iPhone and it's a glucometer. So you simply test your blood and stick it into that sensor and plug it into the iPhone, and it populates an app and goes everywhere. Well, one of the problems for particularly juvenile diabetics testing their blood sugar a lot is it's a pain and it's difficult, and they feel like it socially isolates them, and that impairs their ability to be compliant with that. So one of our film students developed this game called Vampire Rancher, where the kid can actually create a blood farm. And it's almost kind of a Farmville concept. So we're enfranchising the blood. Blood is good. Kids are a little morbid anyway. There are characters like Susie L'Amour, and you have your character, and you build this blood farm, and you can invite your non-diabetic friends by giving them blood from testing and grow this ecosystem that now the engineering school is building out the back end of that. So we look forward to Vampire Rancher and building on some of the vampire stuff that's going on in the popular culture and getting kids to embrace their healthcare.
So this is all what we generally refer to as the gamification of health. And why don't you just talk a little bit more about just how important the whole social networking, gaming, game theory, and rewards are going to be?
Yeah, I mean, it's amazing to me that I have treated patients for 25 years. I was an intern, 25 years ago, and it took me almost 25 years to realize I couldn't just sit there and tell them what to do. I did evolve over those years. I wouldn't scream it at them anymore. I wouldn't, I'd be okay, and I'd try, a little reverse psychology and things like that. But it was amazing to me that I didn't realize it can't be paternalistic. It's got to be a partnership. I've got to go to where they are, reward them, understand their needs in some way that's more continuous than these point visits. Because no matter how much they admire, respect, or want to do what I say, that's not enough day to day when you're struggling with stuff, or you're trying to educate them on the complexity of what they're dealing with, or their own family issues and all the stuff that goes into being sick on top of life. So if you can make it fun, if you can gamify it, if you can reward and you can make them feel, and our studies have shown that even if I'm following a patient virtually, they still feel cared for by me. They really personify that experience. So I really don't have to be there. And then if I am there and it's not as enriched an experience as they would like to have with me that particular day, the other stuff still sticks and they still feel cared for and they're compliant. Plus, the daughter in Vermont is connected. Everybody else who's making it work for this patient feels cared for as well. And that is just huge, because everyone who deals with this stuff knows what those dynamics are like. They're very tough. So that's, we're active in that. And then again, if you get games and you get all this stuff going within large populations of young people or diabetics or whatever, you're suddenly sitting on all this amazing research data. Then you can really make the new products that meet the needs of the patients. Then you're not just guessing that this is what patients need. You know they are, because they're telling you that's what they need, and then they're using your product and you're figuring it out.
Your USC privacy officer made you erase all those tattoos that your football players were erasing, but you and I are now playing with body tattoos.
Right, so those beefcake guys, we had to take all their tattoos off because the NCAA doesn't allow you to market your athletes, and they were really identifying themselves around their tattoos. But this really interesting company, Epidermal Electronics Sensors MC10, is bringing them back. So again, this idea that you could wear something that would integrate with the rest of your life that was medical, and it would allow us to do. They're a very ambitious company that hopes to achieve all of these metrics through these epidermal sensors, which would just be amazing. I mean, imagine even going into a hospital and just getting your tattoo put on. Maybe it's got your kid's name on it, whatever. And suddenly you're not tethered to anything. And everybody knows, what you're doing, including me sitting at home. It's really exciting.
So I can actually be wearing my ECG sensor as a tattoo, as a pirate here.
You can, and you can put it on your kid before they go out at night and figure out what they're up to, pretty much, from these surrogates.
This is why it's obviously a lot of fun to work with Leslie and work with the clinical folks that are interested in these technologies. I told you earlier that we launched our Qualcomm fund, bringing a $100 million venture fund in to focus on investing in wireless health companies. You see a lot of these companies early on. Traditionally, the venture capital community is invested in biopharma, biotech, maybe health IT. How important is venture financing to you from what you see coming through USC?
I think it's huge, and I think people investing in these companies really need to realize that they have to help the companies understand how their technology is going to disrupt traditional medical system. So if it's an in-hospital technology, they really have to help understand and do the use case scenarios in individual hospitals. How does this, even though it's an amazing breakthrough device, does it fit into the regular flow of the way the hospital works? Because if it doesn't, it's not going to work. Is it going to meet some fundamental need of the hospital? The hospital may not care if it's moving the needle on global healthcare. They want to know if they can, have less nurses around, because that's their big cost. So really trying to understand the disruptive nature of this and trying to integrate it into an existing system is a huge challenge. And I love the popular culture piece, because if there's a patient pool, if the consumer, the patient wants the stuff, that motivates the hospital, that motivates the doctors, that motivates everybody in the healthcare system. Trying to pick off each hospital or each individual patient set is a much bigger hill to climb.
I mentioned earlier the TueNet platform that Qualcomm launched, and the opportunity to collect data from multiple kinds of sensors, bring it together into an analytics kind of platform where you can actually really figure out clinically what needs to be done next, advise the patient, advise the practitioner, maybe even come up with a health score, like a FICO score, and figure out whether you're improving or not. We actually have on the floor an example of a company with a product called Macaw that actually does this and actually comes up with a health score. Can you talk a little bit about your view as a clinician of what's going to change in medicine when multivariable analytics plays itself out in clinical care?
Well, that is the end of wireless health, because as I was walking the floor in hour 3 yesterday, not being able to find food and getting a little depressed, all of a sudden I got dark and I was looking at all these companies and I thought, God, we're creating wirelessly the fragmentation that already exists in medicine unless somebody mashes this stuff up. Because even if you're a triathlete and you have to go on one site for your Fitbit and another site for your diet, that doesn't work. And if we introduce now that wirelessly into healthcare, we're going to have the same problems that we have right now. So this is absolutely how it works and why this is the enabler that will allow it to work, because I need to look at the entirety of my patient. They need to look at themselves. Who cares if I'm monitoring their implantable device if they don't know how that relates to their diabetes or their blood pressure measure or something else, or their drugs? So these mashups are integral to realizing the benefit of all this stuff, in my view.
Leslie, thank you so much for joining me today. We've got time for 1 or 2 quick questions, and then we'll thank everybody for joining us. But I'll turn to the audience and see if there's any questions. I know there's mics in the audience, so please go to the mic if you have a question.
Hello. I work for a large hospital, and a disconnect I see a lot in these talks is physicians, biomedical engineers, the hospital doesn't want to use something that's not FDA certified, but talking to a lot of the vendors that provide these devices, and so far none of these types of companies, but some of the more old style, I guess you could say, companies, they say we can't get through FDA certification with standard 802.11 and cellular wireless. In fact, they even produce systems that take down our wireless networks. So how do we use these systems if they don't really interoperate in our hospital?
So we spend a lot of time working with companies on it, and frankly, it's just plain bad information that you can't get a product through FDA that uses Bluetooth or Wi-Fi or cellular. There are plenty of products that are out there already FDA certified that are using those technologies. So a lot of it is actually getting through some bad myths. There are some issues having to do sometimes with interference, especially in a medical setting where you have lots of different radios. That's a little bit trickier, but it is absolutely solvable. Occasionally it requires a circumstance where a particular device can't be used in conjunction with other devices in very, very close proximity, but rarely is it much of a problem once the problem is really understood. Qualcomm works very, very closely with the FCC. This is really outside of the FDA, but we've gotten the FDA and the FCC working together to solve some of the rules and regulations having to do with interoperability, and there's actually more activity going to come onto this space. But it is absolutely untrue. You can get FDA approval, and most of what we showed up here today is either already FDA approved or in the pipeline right now to be FDA approved. So I'm very, very confident that we don't have a technology problem using wireless. We'll take one more question.
Hi, that was a fascinating session. Dr. Saxon, I have a question about the remote monitoring of the patients and how that fits with the current reimbursement system. Do you as a cardiologist is there a way that you're getting paid for doing that remote monitoring?
Yeah. Again, when you pull it into the medical, when you're looking for a billing code, it's much more restrictive. So yeah, I can prescribe any number of these products. The AliveCore thing is currently under 2 FDA reviews, as I understand it, but I can prescribe them, but they're limited. For 6 weeks, the patient can have this a wireless patch or non-wireless patch and get monitored, and we can get paid for it. The majority of the reason doctors aren't motivated to prescribe many more of those is much of the profit, just the way the billing code is constructed, goes to the company and very little to the doctor or the hospital or clinic putting them on. That doesn't matter. We use those because they're important, but it will never, that market will never reach the kind of numbers of people you need to reach to make really meaningful diagnoses over large populations of patients. This stuff has to be out there in the popular culture. People have to be gaming on it, et cetera, to really improve cardiac diagnoses. Because many of these problems occur in asymptomatic people, and their first symptom is death or major heart attack. So you can't wait till they come to you. You have to get the stuff out there, at least in cardiac disease and probably in glucose monitoring and in many other things like cancer prevention.
And we're seeing a lot of new business models offered here where there may be a consumer pay model, there may be combinations with a pharmaceutical drug, and the pharmaceutical industry has an interest in getting the application in the market. Or in some cases, we're actually seeing a Kindle-like model where the medical device is also where you order more product, more supplies, more drugs, or related products, like in the case of diabetes food products, sugar-free food products. And so the business models actually start moving away from the traditional business insurance reimbursement models in some of the cases that are seen. Leslie, thank you so much for joining me today.
Thanks,
I
Tom.
appreciate it. Thank you.